Good afternoon, Senator Anwar, Representative Linehan, Senator Abrams, members of the Children's and Public Health Committee. Thank you. I want to start with thank you for raising Senate Bill 2. My name's Ava Bermúdez Zimmerman. I am the CSCA SEIU local Child Care Director and Organizing Director, and also our local is a proud member of CCFCT, Child Care for Connecticut's Future, who I'm representing today in my testimony as the coalition co-chair. CCFCT's mission is to restructure early education in Connecticut so that parents can find high quality care that is affordable in a setting of their choice that will ensure childcare providers to be well compensated in order to have a stable and skilled workforce. Senate Bill 2 is a step forward to getting that done. There is no right path on how to fix the early education system, but there is also a lot of feedback that we've gotten from parents on what we can do to focus on those changes. The same way as there's no path to fix a broken system, there's also no right path onto parenting. What we do know with early education and the system is that it was broken long before the pandemic was there. And I've heard testimony, we've all heard testimony from Eileen, from others speaking on that reality. Currently, Connecticut is ranked sixth in the country for unemployment with 110,000 job openings and 50,000 infant toddler slots that are not in structured care. So what do those numbers tell us? They tell us that one clear detail is there, that their jobs are available, but something's holding those parents, those workers back from being able to fill those positions. I'm not going to go into a long list of theories as what's going on with the workforce. I'm here on early ed. What I could tell you without being an analyst or going into theory is that we don't have to be experts to know that any parent who works needs childcare. Could it be a grandparent? Could it be structured care? Absolutely. At the end of the day, we know that the structured care that's available in Connecticut does not work. If we want to support the workforce here in Connecticut, we need to make sure that providers stay open. During the pandemic's first year, 30% of the workforce was gone. Many of them weren't able to reopen. They were forced to find other employment outside of the field due to lack of payment, due to lack of structure and support systems that were just not there for all of early educator providers. Most of the educators are getting paid minimum wage or up to $14. You've heard testimony on that. Center and home-based providers who have salaries to retain their own staff are not able to get those wages up to where they need to. And a lot of the providers depend on state, federal, and grants to sustain their programs. And then you're also looking at a significant cost from the parents' end. So when you don't have enough for, making sure that that structured care is available, and when you're looking at parents who are sacrificing and nickel and diming to pay for childcare, it creates this broken system. The emotional toll affecting the system in the area, the stress on the parent who can't afford it, the stress on the provider who can't afford having a child attend for free, the stress on the assistant who makes minimum wage. We asked that Senate Bill 2 secures $700 million. I know, Representative Steinberg, you were in shock and awe when you heard that number, but that truly is a number that we need to help the crisis right now. It's not, long term, this is just for this year. So I want to thank you for your time. And the last little tidbit I wanted to add, Representative Steinberg, when you asked Eileen Costello, how much would the cost of care be for the state legislature to fulfill universal childcare? It's $2.5 billion. So right now we're looking at 21,000 early ed providers. You have, like I mentioned, 50,000 children in unstructured care, an additional thousands of children who are in structured care. 2.5 billion is the realistic number to have free, affordable childcare, universal childcare for everyone. But this year, the first stepping stone is at 700 million. I'll open myself up for questions, and I have data and citations in my written testimony that I will be submitting. Thank you.
Thank you for that wonderful testimony and for making us blanch once again in terms of what we really need to do. This is a national crisis with daycare. We must do better than we are. Our system is not enabling parents to participate in the workforce, let alone take care of our kids. There's so much we need to do. As daunting as many of these numbers are that we've heard today, we need to recommit ourselves to find a way to do a lot better than we are. I'll just leave it at that. Thank you. I don't see any questions.
Thank you.
I think we're all apoplectic at this point, but we'll continue on. I'm going to hand off now, I believe, to the Children's Committee Vice Chair.